This conference will now be recorded.
Hi, hello. Thank you for everyone who's joining us today and who's logging in. My name is Meenal Patil. I'm one of the anesthesiologists at Reconstructive Orthopedics, and I'm practicing interventional spine management there. But today I kind of wanted to switch gears and talk a little bit about managing our stress and trying to stay optimistic during the pandemic because I think it's a really needed topic and hopefully it can help all of you out. Before we get started, I wanted to just explain and thank you for being understanding with us in terms of our office and how we are managing to see patients, especially over these last 2 months. I wanted to reassure everyone that we are taking the utmost precautions to keep you and your family safe, as well as our staff safe. And so you are likely to be seeing a lot of changes in a positive direction in our offices. So we are currently limiting the amount of patients that we can see per hour to ensure that we are cleaning everything appropriately. Everyone is being screened before they enter the building for risk factors for developing the COVID-19 virus. And so, we appreciate your patience with that. We have also implemented virtual waiting rooms, and so we are minimizing the time that you're physically in the building in our waiting room, and we hope that that makes you feel more comfortable as well. All of our staff has been wearing masks, and we have gloves and cleaning supplies, and we appreciate your availability to wear the masks as well. We are also offering a lot of telemedicine services. All of our providers have been utilizing these visits over the past few months, and we're likely to continue to be able to offer that to patients as well. And then please remember that we are available in the evenings as well as on weekends at Ortho Express, and the hours can be found on our website. Oh. Sorry about this. Okay, so with that, I'd like to get started with the talk. I hope everyone can see the screen here. So the title of the talk is Managing Stress and Staying Optimistic During the Pandemic. So a little bit about the coronavirus, COVID-19. A lot of us know kind of bits and pieces about this, but I just wanted to share a few slides about an overview. So the actual disease is called COVID-19, and it's caused by the virus SARS-CoV-2. This was named after a similar virus that had caused similar respiratory symptoms many years ago. We refer to what's going on now as a pandemic because that means that the virus has spread throughout the world. It's certainly been focused in certain areas of the country like New York, New Jersey, but it has been seen in most of the countries in the world. Symptoms can range from mild or asymptomatic, meaning you're not feeling anything different, to severe illness. And the way that the virus is spread is from person-to-person contact. So most commonly through things like sneezing, coughing, where there's forceful expiration, and also talking in close distances. And for that, we are asking our patients as well as us to wear the masks so that we can minimize the spread. There's also spread of the virus from touching infected surfaces and then touching your own face or hands. And so this is why it's really important to wash hands frequently or use hand sanitizer and also disinfect surfaces that may have been put at risk. So other ways to protect yourself and others over the last 2 months, of course, this has kind of been the biggest thing, is just to stay home and keep social distancing guidelines so that we can minimize the spread. We also were trying to minimize and flatten the curve so that providers were not overwhelmed in the hospitals by large patient populations of sick patients. And thankfully, we've really managed to achieve that. And so as the next couple of weeks, we'll see, the restrictions will start opening up and hopefully things can continue to be towards normalcy. It's still important to follow guidelines for social distancing, and as I've kind of put this talk together, I've realized that the governmental agencies and also our town agencies are great resources to see exactly what types of guidelines are in place and how things are changing, because they are changing fairly frequently as more and more data comes out. It's important to wear cloth face coverings. These do not need to be fancy in any way or have any certain specifications. The important thing is to just be able to cover your nose and your mouth. And so if you have bandanas or scarves at home, those things tend to be sufficient for people going out and about in public. As I said, it's important to clean and disinfect surfaces, and even if there aren't antibacterial wipes available, because those do seem to be in short supply, soap and water is a really nice alternative and should be still available. Washing hands often, and it's important also for us to know our risks. So everyone is at risk for getting the virus, though people with certain medical comorbidities and underlying medical conditions may be at higher risk. So according to the Centers for Disease Control and Prevention, which is called the CDC, they have identified multiple stresses that can be concomitant here with this pandemic. And I'm sure that many of us are feeling many, if not all of these stresses. And so I just wanted to identify these. Many people are feeling fear and worry about their own health, as well as the health of their loved ones. Oftentimes, we are put in situations where we can't be with our loved ones and can't offer the type of help and guidance that we had been before because of social distancing. There are changes in eating and sleeping patterns. When we're stressed, we tend to either overeat or undereat, and also have worry affecting our sleep. Worsening of chronic health problems, worsening of mental health conditions, and also increased risk of alcohol, tobacco, or other drugs. Anecdotally, I found there's uncertainty about guidelines. It's sometimes hard for people to understand exactly what is the right thing to do, because you may be seeing your neighbors or people in different towns or different parts of the country following different guidelines, and so that promotes anxiety. Uncertainty about our financial future. Many businesses have taken pretty large hits over the past few months, and it's difficult on how to predict how things are going to go going forward and how we can continue to care for our children and our families. Many people are working from home or have unfortunately lost their jobs or been laid off, and so the lack of routine has really been a big stress as well. And again, lack of social support, especially for people who are used to being involved in other activities and things like that. That's really been a big stress. So a couple of things that we all can do, and it's okay to have to remind yourself frequently of these things because it's easy to become stressed, are to just take a deep breath and realize that we do have some control over our own lives. So primarily we can assess our risks. If we're staying inside and following social guidelines, we do have control that we are minimizing our chances of getting sick. And so that's one thing that can be a little bit of a comfort. It's important to identify what you can control. You can control what's going on within your house or how your day is structured. You can control what you're eating and how you're exercising, and a lot of those things can give you some comfort. So it's also important to accept what we can't control, because those are the things that tend to cause ruminations and anxiety and stress because we're worried. But once you can kind of accept that and say, there are things that I can do to mitigate my risk, then that can ease your anxiety some. I think it's nice to be able to create a plan to manage your stress. So for me, it's helpful to kind of think through my day at the beginning of the day and know what I'm going to be doing in little chunks. Trying to tell yourself I can handle things rather than I'm worrying that X, Y, and Z is going to happen, because there's not much you can do about that. And this is also really important to stay informed, because that can give you some control over what you can do and can't do, but to not obsess over the news. There are so many outlets that are available to us because of smartphones and constant stimulation from videos, that it's easy to get overwhelmed and it's hard to know exactly what to believe. But it's important to focus on reliable and data-driven resources like the cdc.gov and also local town websites, so that you can take all of these pieces of information and make some semblance of like a reasonable plan for yourself and your family. So what to do if you do feel ill? Sometimes I hear patients saying, my doctor's office is closed and I can't get a hold of them. And I want to reassure everyone that not only our offices, but most all doctors' offices should still be open to some extent. Though oftentimes you might get a recording or someone might need to call you back. Patients are still being seen and we're still taking care of you. Telemedicine has been a really nice option, but if that is not right for you in your case, we are still seeing patients and taking the utmost precautions to keep you safe during that process. Of course, if you're having any shortness of breath or any worrisome symptoms like chest pain, same as before, get attention immediately. Just because you may be worried about going to the hospital because you may be worried of contracting the virus doesn't mean that you should delay care for yourself, because that would be terrible. So please keep in mind that 911 and emergency operators are still available. Separate yourself from others as much as possible if you're finding that you have mild symptoms and you don't need to go to the hospital. And that way you can try to minimize the spread to your family and the people around you. Wash hands often and avoid sharing personal items. And sometimes that's hard if you're the sick person in your family, but try to do the best you can and know that you're minimizing the spread to your family. So I like this graphic because it's something that we should all remind ourselves of, because likely these guidelines are going to be in place for some time, but it's important to try to stay calm. So I also want to speak a little bit about taking care of your body. A lot of times when you're in pain or when you're suffering from an illness, we can tend to focus on the things that's wrong, but there are things that we can still control in our bodies. And sometimes it's helpful to just take a couple minutes, take a deep breath, or even meditate. And if you are new to that concept, the website called Headspace is a really great website and resource. I believe that it's free for patients or for people who may have lost their jobs right now, but it may be that you can find some low-cost resources as well to help with meditation. It's important to eat healthy and try to make an honest effort to do that, because your body is still healthy right now, and we want to keep it that way. So a lot of places like grocery stores do have curbside pickup where you can order online and minimize the risk of going into the store. For the older population, often stores have an hour in the morning where they're really keeping that hour reserved for patients who are at risk for the virus. And so usually that will be like a less crowded hour and a good time to go. There are a lot of CSAs and vegetable and fruit farms that are delivering to doors. So those are some things to look for too, because that way you can have a regular schedule of fresh vegetables. And other delivery options through the restaurants certainly available, so that you can minimize your risk of getting sick. We're lucky, today is a beautiful day. It's going to get even better, and so trying to get outside is something that we should all really aim to do. It just makes you feel good and kind of forget about things and forget about the screens and the stresses of everyday living. And then at the end of the day, it's really important to have good sleep hygiene. So for many people, it may be, and for myself, I kind of like to watch TV and sometimes watch videos at night, but I have to remind myself that too much screen time also kind of promotes bad sleep habits and poor sleep. And so it really should be a time where you can kind of decompress from your day. So a couple other ways of having good sleep hygiene: avoid stimulants close to bedtime, and avoiding screens about an hour before bedtime. So maybe try to pick up a book, find something that you haven't read in a while or that's been sitting on your shelf. Try to do some yoga or some meditation. And then if you're working from home, what we see often is that patients are coming in with low back symptoms or neck symptoms that are new because they've been sitting so long at their desks and they're not used to doing that. And maybe the computer's not at the right height. And so something to really think about so that you can minimize your own injury, even when you're just sitting at your desk. It's also important to exercise regularly. Okay, so I also wanted to talk about taking care of your mind because we should be really in tune with that in terms of our stresses. So it's important to try to connect with others, even if you're doing social distancing and isolating yourself, because social distancing is really physical distancing. It doesn't mean cutting yourself off from the world or from your friends, especially if you tend to be anxious or depressed or suffer from other mental illnesses. It's very important to, during this time, keep in touch with your providers and your support system. It's also important, especially if you're sitting at a desk all day, to take breaks and allow some rest time during the day. And then if you're caring for children, like a lot of us are, who are used to be at school and are now at home, they are intimately in tune with what's going on with your life and your stresses. And while it's okay to let them know that you are stressed and this is kind of a stressful time, it's also important to try to provide some guidance and reassure them that they're safe. In our family, we try to do as much as we can to create routines, although it's been tough. But generally, kids are resilient and they can also be a source of comfort for you. All right, so exercising at home. There are a lot of free apps that are available these days, especially since the shutdown about 2 months ago. A lot of apps have been available when they really weren't, or that you had to pay before. So one of the apps that I use is called Peloton app. So you may have heard that this is associated with a bike or a treadmill, but the app is really nice because you don't actually have to have any equipment at home and you can still use the app. Right now they have a 30-day free trial. And so I encourage you to just download it or take a look at it and see if that's something that might work for you. Even if you don't have the bike, you can still kind of be kept accountable, and they have a calendar and you can log in and see how often you've done the exercises and things like that. The important thing, I think, is if you've never done anything like that, to try to keep it so it's not going to be overwhelming. They do have 5 to 10 minute type exercises, and so that's a very reasonable thing that you can find time to do during the day. There's also YouTube videos that are free, and then the Yoga Studio app and website provides some instruction on general yoga. And there's also the Johnson & Johnson official 7-minute workout. So you can Google kind of free apps for exercise, but these are a couple that I like. When you're exercising, especially if you're new to this or you haven't really done some of these things, it's important to start slowly and limit your sessions so that you don't injure yourself. But listen to your body, and I think that you'll find that you can engage in some of these things even if you've never done it, and hopefully find something you can stick to on a routine. It's also nice to find a friend or family member to join you. Maybe your kids or grandkids can do the same types of exercises, and if they don't live with you, you can also do it by video together. So some of the outside activities that you can consider doing involve taking walks around your neighborhood or town. Some of my neighbors have found that they try to walk every street in our town just to kind of get a better source of the area, and also maybe see some neighbors and just have some town pride. So that's something to look into. You can consider gardening for yourself, or even helping some neighbors who you know may not have the funds or the abilities to kind of keep their yard upkept. So now is the time to start the planning, and you'll find that it really brings you some joy. Spring cleaning, always something to be desired. No one really wants to do it, but now that we're at home, it's always that much more obvious what things need to be done. So You can try that out. And also looking at the wildlife now that there's less cars and people driving around on the roads, I find that I really enjoying birds and seeing the wildlife in my yard too. So I just included a couple slides about the different parks. Now that they're open again, it's a nice opportunity for us to go and explore different areas while continuing to follow the guidelines that are typically written on the website. So this is the Burlington County Park System, the Camden County Park System, and these all have their websites, and I've included that at the end of the presentation as well. And then the Gloucester County Park System as well. One place that I really enjoyed, and I went there for the first time the other day, was the Woodford Cedar Run Wildlife Refuge, which is in Medford, New Jersey. It has about a mile or a little over a mile trails that are flat and very reasonable for people who may have trouble walking or children. And I went with my children and they really enjoyed it. At the end of the trail, they have the animals in the cages that were rescued and cannot be released back to the wilderness because of safety reasons. And so it was a really great time, and it's nice for us to be able to support a community resource like this, which really provides so much care for animals. So we're all asking when we can go back to the beach, because that's something that would be you know, we look forward to it all year, and encouragingly, Governor Murphy said that we can probably resume going back to the beach pretty soon after Memorial Day. So you can see this update is effective May 22nd, that even though they're going to encourage social distancing and group gatherings and things like that, we can all go back to the beach. So that's something to definitely look forward to. I wanted to include this slide because you may not know what all apps are out there for connecting with your family and friends, but a lot of these are very commonly used and are probably on your smartphones already, or can be easily downloaded. So the FaceTime app is on all Apple products, Apple phones, iPhones, and so it's just like calling someone, except you just press the FaceTime button and then it's a video chat. Similarly, Google Duo may be on your Android phone, but it's also an easy upload for any smartphone. And it's a way to video chat as well. The Zoom app is a way to do large group discussions, and if you have children or grandchildren, they're probably using that for school. So that may already be on your computer. A House Party is another group video chat, and then WhatsApp, and all of these are free downloads. WhatsApp is nice because you can do video and text chat internationally over Wi-Fi. Another way to kind of reach out and to get yourself maybe out of the house or kind of out of your rut is to volunteer to help others. So there are still possibilities and opportunities to help others in the community despite our social distancing guidelines. You can reach out via email to your community leaders, because there may already be systems in place for you to be a volunteer to someone in your community, in your town. But even more locally, you can check on your own neighbors, even just send them a note in their mailbox if you, or wear a mask and go to the door or through the window to offer to help get groceries or help with yard work and things like that. And then there are also volunteer opportunities virtually. The Be My Eyes app allows people who have normal eyesight to be able to help the blind in managing different activities. This is also a good time for all of us to kind of be aware of our environmental impact. So, you know, especially initially going to the grocery stores, there was a big sense of panic and people were overbuying and then the stores were empty. And we're realizing that even though a lot of that has improved, the stocks of certain things may not be there anymore. And so we want to be able to use what we have, use it completely, not waste food, freeze food if you can, compost, and then store food properly for the future. There are blood drives going on and also plasma, especially for people who may have recovered from COVID-19 already. If you have the funds to be able to do so, donations are, I'm sure, accepted everywhere, especially for things like food banks, the South Jersey Food Bank. And then remembering those on the front line. So an easy way to help out because there is still a need for things like this, or homemade masks. I included the website from the cdc.gov because even though you may not be able to sew, there are other ways of making the masks that are no sew. And so I've been getting my children involved with this. And if you have any old t-shirts, that's the type that we've been using. So please look into that. And just know that we're all in this together. Thank you.
Thank you, Dr. Pottle, for all that wonderful information. We'll open it up now to any questions. I didn't see anything come through the chat box, but if anybody had any questions or comments, since it's a small group of us, you could go ahead and unmute your mic and you could just talk to us. Oh, wait, something came in the chat box. Veronica says, this was wonderful information.
Thank you, Veronica.
Thank you, Dr. Pottle. This was wonderful. I think I love that you added the links for volunteering too. I know that I've gotten down. I'm used to being out and about and not being able to do that. Mentally, this has been very hard for me. I have family members who are sick with cancer who I haven't seen in 8 weeks, and it's very trying time. So it's great to have opportunities like this and to connect with people that you used to connect with and learn some tips. So thank you for that.
Sure. Thank you.
Meenal, hi, this is Gary, of course. How critical do you think it is moving forward that we eventually all become tested?
Oh, I wish I could really speak strongly on that, Gary. I don't know. What I can tell you is that, there are more and more tests being available, and I believe that the antibody tests are becoming more available as well. I think some of the uncertainty lies into how reliable those tests are, but hopefully within the next couple of weeks, that will be, a little bit clearer for the population, so that we're not spending money, or rather, if we are spending money on getting the testing, that we know exactly what those results mean.
How long would typically an antibody last?
Oh, I don't really know. I don't know if we know a lot of the answers to these questions. For example,
Right.
I don't know if we know even if the antibodies are positive, are they that protective?
Right.
I think it's still unclear.
Okay, thank you. Yeah, very nice talk. We really appreciate your information.
Oh, thanks, Gary.
Very much.
Well, thank you to everyone who tuned in. Yeah, I appreciate it.
Yes. Thank you, everybody, for joining us. Thank you, Dr. Pottle, again, for taking the time to meet with us this afternoon. If there's no more questions, I think we could go ahead and conclude today's session.
Great. Thank you. Have a great weekend.
Thank you. Thank you.
Bye-bye.
Very much.